Now, something more practical on individual level. If I start to
Mm-hmm.
cough and sneeze,
Mm.
what do I do? What do I do?
Uh,
Do I call the ambulance do I go to the clinic or what?
okay, so it's not enough that you were unwell in some way. Initially, it was that you have had to have fever, but then they said sometimes even without fever, you can have COVID-19. So as long as you have shortness of breath, cough, sore throat, the main respiratory symptoms, and if you had recent travel to outside of Malaysia within 14 days, or you've had close contact with someone who's suspected or confirmed to have COVID-19, then we screen you. We take a swab from the nose and from the back of the throat, and the result is ready in about 24 to 48 hours. Um, Now we've moved along to identifying those at risk without symptoms. So if you're found that someone in your home has tested positive, or you've attended a mass gathering and you're worried, and the contact that you know is of a close in nature, a close contact. So there's less than 1 meter, more than 15 minutes, sharing of common spaces, sharing of utensils. Even if you don't have symptoms, we are now testing you as well. Okay, so that's what the public needs to know. So if you are in contact or having attended any of these mass gatherings and you hear that there's a cluster or you hear some people being positive, you can come forward to be assessed for testing. But back to your question that what if I just have a simple runny nose, cough, sore throat, a little bit of difficulty breathing, maybe even an asthma attack, yeah, because you are asthmatic. How do I know if this is COVID-19 or not? I've not traveled anywhere in the past 14 days, but hey, I've traveled to Malaysia. Malaysia has COVID-19. So the most immediate and the easiest thing you can do is you can call our CPRC. So that's the Crisis Preparedness and Response Center. That's the center that's set up by the Ministry of Health. And I'll just read out the numbers to you. They're 24 hours, okay? And they have 3 hotlines. So that's 03 888 0200 or 03 888 0600 or 03 888 0700. And this is the number, okay,
Yep, got it.
that you can dial, that the public can dial to reach out for general information on what they should do in the time of this pandemic. So they will be advised, they'll be asked a set of questions, and if they deem you to have high risk or the need for screening, they will ask you to come to a government facility, such as ours, in order to test. If they feel that you are of lower risk, then you will be advised to head to a primary healthcare facility, such as a private clinic, to get tested. Sorry, to be assessed by a doctor and uh, to be treated accordingly. For the
Okay.
general public, at the moment, if you would like to know, there are more and more testing services being made available. As you know, may have heard, there are a lot of labs and a few private healthcare centers who are providing uh, uh, COVID-19 PCR testing for a fee. The cost is in about several hundred ringgit. And the criteria for testing then does not have to be as strict as the one imposed by KKM. So if you feel that there is a need for you to get tested and without having to go through the hassle of CPRC or government facility, just know also that these private services are available for you for a fee. Uh, know that also if the services are available, that they should already have been approved by KKM, because they need to have a mechanism in which they need to report and trace cases they have found to be positive. So if a certain lab has already tested an individual and the test result is positive, they need to inform CPRC, they need to inform MOH, and subsequently the pejabat kesihatan daerah is going to be in charge of identifying which hospitals should respond. And in our experience, the PKD ambulances will actually come to the homes of these people to reduce the risk of travel and transmission, pick them up from home and bring them to the designated hospital. So even the private testing facilities, they should already have a mechanism in place.
I see. Okay, that's good to know. Good to know. So there's a hotline to call, and then they'll tell you on what to do next. It's great.